I'm Jason Craig, and I am the Director of Planned Giving here at Phoenix Children's. We're very glad that you could join us. These are extraordinary times, unprecedented. And during these times, we try to find innovative ways to reach out and still stay connected with everybody. But we still have to maintain those physical distancing requirements because we are we take very seriously the health and safety of our patients, staff, and the community as of paramount importance. So since this is kind of a new format, let me explain how the conversation is going to flow. But first, if you are people that are on your Zoom, if you kind of look down here below in the bottom of your screens, you'll see that will pop up something, a chat, mute video, and you can also click on participants. And if you click on the participants area, there's also something that will pop up and it'll show you who's in there. And it also gives you an opportunity to raise your hand. But as we get going, we're going to start out by muting everybody so we don't have background noises and things of that sort.
So Jason, it looks like someone can't hear the conversation.
Okay.
I also wanted to make a comment that the phone number that Elisa sent out does not work. It's a non-working number. So some people might be trying to call in on their phone but can't.
We do have somebody on here right now that might be able to help us, but other than that, with the sound, I'm not quite sure that when you come into the Zoom, if you don't join through your computer audio, you have to dial it separately on your phone and then type in a meeting number and a participant number, and then it will link you in there with your phone. But if we did not have the correct phone number, perhaps we could get somebody to send out a new mail, a new number. It's 346-248-7799. And the ID number is 959610. If you can't hear, but you can see it in the chat box. You'll see the meeting ID number.
She says she can hear it now.
Okay, perfect. All right. Well, with that said, I'd like to introduce Lynn Badura. She is my partner here at Phoenix Children's, and she's going to talk to you a little bit about our Legacy Society.
You have to unmute, Lynn. Need to unmute.
Lynn?
Sorry, it's unmuted.
You're there now.
There, now we can.
Hear me?
Yes.
Okay, sorry about that, everyone. I'm not sure what's going on. Again, my name is Lynn Badura, and I work with Jason in the foundation office. And I wanted to say a big hello to many of my donors and friends that are watching today. Thank you so much for joining us. As you know, Legacy Society is a very important part of the foundation. Legacy Society is comprised of our donors who have made a commitment in their estate plans to Phoenix Children's Hospital. And these commitments are very important to the hospital as they allow for future growth and additional funding down the road as we go into strategic planning and plan for the future. So we very much appreciate everything that you do for us. And just remember that no gift is too small. We do appreciate everything. Also, philanthropy is committed, or there are 60 programs, I should say, at the hospital that are solely funded through philanthropy. So it's very important to us to have community support. With that said, I'm going to turn it back over to Jason to introduce our keynote speaker this afternoon.
All right, well, thank you, Lynn. Today, at this time, I'd like to introduce Rhonda Baldwin. If you look up on your screen, you can identify her by she's the one with the bright red background and she's waving. She currently serves as the manager of social services, supervising 40 social workers across all kinds of areas. They include solid organ transplant, hematology, oncology, trauma, forensics, the inpatient psychiatric unit, a very busy emergency department, a level 1 pediatric trauma center. And finally, she provides support to several pediatric specialties who follow children in the hospitals, very high volume and very diverse. And in that work, social workers provide emotional healing for people facing a variety of medical and health-related issues. And they're really on the front lines of trying to integrate physical and mental health from a biopsychosocial perspective. Now, Rhonda is going to share with you some information on the current state of the hospital, and along with some new programs that Phoenix Children's have developed to respond to the current situation that we're in right now.
Thank you, Jason. And thanks everybody for having me here today. It's hard being a social worker and isolating from people. So it's nice to be able to touch base with everyone. I really enjoy talking about what we do at Phoenix Children's Hospital because I think what we do is unique among other hospitals in the Valley. And I've been with Phoenix Children's Hospital for 12 years. For 3 years, I worked with families whose children had leukemia or where there were bone marrow transplants that needed to be completed for children. The last 9 years, I've been the manager. And I think what you learn when you're here is that your heart goes out to families who have sick children because it's so stressful to be in a hospital. It's so difficult to really kind of keep track of what's going on. And so our goal at Phoenix Children's with the social work department is just to make people's lives a little bit better while they're here so that they understand that we're all in this together. So did you want me, Lynn, to go?
Lynn, you're muted again.
Sorry, everyone.
I can see you talking.
Hey, anyway, Rhonda, can you tell us a little bit about the hardship fund at the hospital?
Yes, so I'd love to talk to you about that. So social work sees, if we don't see someone sooner, we see every family within 72 hours. And in those discussions with families, we try to figure out kind of how we can best. Sometimes it's emotional support, sometimes it's community resources, sometimes it's other financial things. So it can be anything and everything that we try to help sort out for the family, like through a very emotional time when it's hard to really understand everything. So once we identify a need, then we try to help figure out, it's like putting a puzzle together. How do we help the family get what they need? And so it makes it easier when we can really just respond immediately in the moment. So let me give you an example of kind of what we see every day here at Phoenix Children's Hospital. You have a family who is having a lovely time up in northern Arizona out on a camping trip, riding their ATVs, and there's an accident. Their 9-year-old gets thrown off the ATV, loses consciousness, looks like there might be broken bones. So the child is air-evac'd down to Phoenix Children's Hospital in order to be treated, and only one parent can come in the helicopter. So already there's the parents are being separated from one another. They come down here and then we meet with them. There's the emotional support component because they're worried about that. We find out that, they didn't bring anything with them to purchase food in the cafeteria. We can give them a food card. Right now, Ronald McDonald House isn't open, so they need lodging. They don't have family and friends down here. So we can, through our hardship fund, we're able to provide lodging at a nearby hotel. They are worried about their other children, so we can provide them with support about how they can work with their other children through those kinds of things. And that's kind of all. And then we find out that they don't really have transportation to get back, so we can help them with gas cards for that. So we can help them with a full array of things in that moment.
Well, Rhonda, how is the hardship fund funded?
The hardship fund is funded exclusively through donors. It is only donor funded. We have no other fund sources that we use. So it's only through donors that we can offer all these things to people. And maybe it seems like a small thing, but it's really huge in the moment with that family. The other thing we're seeing is quite a bit more because of the COVID, where people have a lot more financial difficulties too.
Actually, I was just going to ask you if you had an example of maybe families just here recently that have experienced some hardships, and if you could share that with us.
So I actually have two examples from today.
Oh, good.
We have a family here whose child was air-evac up from Yuma for, I don't know exactly why, but the child's in our intensive care unit, our pediatric intensive care unit up here. And the family has no place to stay. So we were able to use the hardship fund to get them a place to stay at the hotel that's close by, Staybreed Suites. And so that we can put them up there so that the family can be together, even though there might only be one person at bedside at a time. The other thing that happened just today is we have another family. Mom is like 35 weeks pregnant. She has a child here in the hospital, and now she's behind on her rent because she was laid off due to COVID. And so we're going to be able to help her with rent.
Well, I'm glad you mentioned families coming from Yuma. As many of you know, Phoenix Children's Hospital does service the entire state and also much of the Southwest region. So we are drawing families from miles away. And so having this resource available is really important. How are families, Rhonda, able to access this resource?
They only, it's just a conversation with the social worker. They can either, when they get admitted, there's an information sheet that's left for them about things. Sometimes that's a little bit hard though, because they have so much information that they get on admission. So all they have to do is ask the nurse to talk to the social worker. Or that's all they have to do. And then we will meet with them after that. The nurses are really good about calling social work and letting us know when families have questions. And so we can go talk with them then right away. And once we do that, once the social workers do their assessment, we can then access those funds. We track everything and follow all the guidelines we're supposed to, but we can then access those funds right then and there.
That's great. Tell me a bit about the meal assistance program as well. I'm sure that's another program that's really needed at this time, that we're experiencing such great need within the community and at the hospital.
Well, it is really a big need right now because the resources in the community are really overtaxed, particularly when it comes to food. So like a lot of the food banks that we may have referred families to previously aren't available anymore. So we have a series of different one of the food programs we have, they're like, they look like a credit card type of look, and we load those with $25, and then the parent can take those cards down to the cafeteria and swipe them just like a regular credit card and use them to buy whatever food they would like. We like that option a lot because it helps families. We always encourage families to take care of themselves and get a break from the bedside and do those kinds of things. We also have families though that can't leave the bedside. So if their child is being tested for COVID, they really are supposed to stay in the room with the child. They're like self-quarantined in there. So for those families, we have a special fund where we can order them, they can order in room service for 3 meals a day into their room. We also have like little vouchers that are for $6.50, where maybe someone had to wait an extra long time to get the test results back for something. And so this way just helps the family go get a meal if they're still waiting for something.
Okay. Great. We're going to open up the conversation now to questions, and you all will see the bottom of your screen in the middle. There's a little chat box, and you're able to type in your question for Rhonda. So does anyone have questions this afternoon?
Oh, one other thing I wanted to mention while we're waiting for questions. The other thing that we have available is we have like grocery card, we have gift cards for groceries. Because the hospital is actually pretty close by to a Fry's grocery store. So we offer families, can offer them grocery cards too if they want, if they're having difficulty with food issues, even at discharge.
Very good. Do we have questions? I'm not seeing any questions coming through just yet. What other programs, Rhonda, have been, very needed at this point in time that you're experiencing at the hospital, maybe more busy than usual?
I think the biggest demand for us right now that we haven't experienced as much is with food. Not food while in the hospital, but people having access to food at discharge. So when we discharge these children who are still, healing from their, whatever their diagnosis was while they were here, we don't want them to be without food. And we haven't really seen something like this before where people can't access the food banks in the same way or get assistance with food because of the pandemic. So we're seeing that as a big need, and lodging as a big need because Ronald McDonald House isn't taking new referrals. So we don't have that resource in the community available. And we're also seeing a lot of people who are in that where they've lost their job and now 3 to 4 weeks have gone by, and they really, they can't make, they can't pay for their rent, their mortgage, they can't do those kinds of things. So we're seeing that a lot more than we ever have. Oh, it says, how many patients and families are served every year through the hardship fund? How much of an increase are you expecting? So on the food programs last year, we spent over $100,000. So that served about 4,000 families with just our hospital food-based programs. With our other things that we do for transportation, things that we do helping with gas cards or lodging, we're probably talking about another couple thousand people that we've helped in various ways through the hardship fund.
I see another question down there. Is the program funded entirely from donations? How is that funded?
Yes, the program is exclusively funded through donations. We do not have any other funds that come into that other than, and those donations include, employees can donate as well. So we also have employee donations where they're donating their salaries into different funds at Phoenix Children's Hospital. So we get a lot of donations from employees there too, but it's all donated funds.
Okay, and there was a question up above there that said, are you seeing a large jump in the percentage of patients that need to utilize it? You kind of touched on that already, didn't you?
Yeah, it's hard for me to put an actual percentage, but every day we're seeing more. So a few weeks ago, I would have not really said we would serve many people with lodging, and now we're seeing like 3 or 4 a week. And before they'd be either at Ronald McDonald House or we'd have some other option. I'm not sure when the other question is, will the hardship fund be needed once we're past this crisis? I don't know. I don't know how long it's going to take people to get past the crisis, in the sense where financially they'll have saved, have enough money now where they can pay all their bills and do all that. Because sometimes once people get behind, it's really, really hard to get caught up again. And so I see us needing this for some period of time. I'm just not sure how long. We've always needed, even before the pandemic, with the food programs, we were seeing a lot of need for that. You know, even just to give families, and we're talking about all families, we're talking about families that have insurance, but maybe they have really big deductibles or a lot of co-pays. And so just a little bit of something to ease the stress of the hospitalization is what we're hoping to do.
Yeah, and it's probably not hard to imagine that going forward with the economy, talking about reopening it and things of that sort, that it will have a rippling effect, and it will take a while for people that do get back to work and do get things going again. It's going to take them a while to get to the point where they're financially stable and secure where they were before. It looks like we got another question here. Beyond the hardship fund, what other needs are you helping families with?
So we have have started a program that this is like employees do this. So it's not there's donations for some of it, but we are seeing a lot bigger need for people with mental health issues, and children who have depression, anxiety. And so we have a whole program now of therapists who are available to work with families and patients and children to help them if they have a mental health issue. We also work really hard to connect families into other services, no matter what they might be, for mental health issues. So that's one of the needs that we've seen huge growth in over the last few years. Children coming to the emergency department and having mental health issues, being suicidal, aggressive behavior, all different kinds of things. So we see that quite a bit, and we try to help with that as well. So we're building out that program.
All right. Are there any more questions? Anyone out there have anything that they'd like to know about? I don't see any, so if that's the last question, we want to thank you, Rhonda, for joining us today and kind of spreading the word out into the community for us. We really appreciate that a lot.
Well, thanks so much for, it was really nice to see people. Hello. So
Yeah.
And for the rest of you, I see sitting on your couches and in your dens, in your protective enclosures there. We thank you very much for taking the time out of your day to join us. We really appreciate it. We plan on doing some more of these in the future. This is kind of our first get-go, so we would appreciate any feedback that you can share with us, or if there's any questions, or if you want to help us out or do anything of that, we would appreciate that feedback. We will send you out an email after we're over here, and you can follow up with us there. So if there's nothing else that anyone wants to ask, then I think we're done. Have a great afternoon, everyone, and stay healthy.
Bye, everyone. Thank you. Thanks, Rhonda.
you're welcome.